Germany is often seen as a role model of universal healthcare, but in reality, this system is in a crisis.
We pay for a Mercedes, but we drive a Golf. We are really in a relatively bad situation, which I haven't seen for many decades.
Germany spends about 12% of its GDP on healthcare, more than any other country in the European Union. At the same time, hospitals like this, Berlin's renowned Charité, are understaffed and overburdened, causing public dissatisfaction and waiting times to soar. So, how did this happen? First, you need to understand how this system is funded. Public healthcare in Germany is funded by both the employee and the employer. The cost is split evenly, and about 18% of your paycheck goes towards health insurance. Nearly 90% of the country is insured this way. But the problem is, certain groups can opt out of public insurance and instead pay directly for private healthcare, including the self-employed and those with high incomes. These groups make up almost 9% of the population. If they were required to pay the same rate as everyone else, the public system could have millions of euros more in its budget. The aging population is also a major factor. Germany has a growing older demographic, and fewer people are paying into the system compared to the high numbers that are using it. But even when it comes to how Germany provides healthcare, the costs can become needlessly expensive.
In international comparisons, we do treat patients within a full hospital stay, where other countries far more common do it without a hospital stay.
But what's being done to solve this crisis? Some experts think hospitals should focus on where and how they treat patients.
There are several reform steps which we really must take, making hospitals more efficient, which means centralizing the hospital structures and making sure that hospitals only treat those patients where they have a high expertise.
And the German government says it's commissioning reforms to stop healthcare costs from rising, which could at least ease public dissatisfaction. But reforms take time, and the pressure is growing. Germany's healthcare system is still holding on, but for how long? And what about the healthcare system in your country?